There's so many opportunities to learn. We set up we worked hard to create a safe space for people to speak up. As we had a spark in our department that got it going in terms of some conversations that happened naturally. And then, people were like coming to me in the hallway, like, I want to support this. I want to talk, but I feel like I have no credibility. And I'm like, if you say in a room full of residents what you just said to me, automatically you have credibility. The other common theme is, I fear of making a mistake. Like, we have to create a safe place for people to make mistakes. We all make mistakes when we're learning. And so it was interesting. I told one person, I'm like, I make mistakes all the time regarding this. This is biases are inherent in who we are. Obviously with, racial justice and what's happening with African Americans is I think in a different boat, but it was comforting for them to hear from me that I make mistakes. And so I'm like, we have to create a safe place so that we can learn, make mistakes together, pick each other up, and keep going. I mean, we're not going to move the needle on this if we're cutting each other off at the knees before you have to leave your ego and your fragility at the door, and you have to create that space. But there's so many opportunities. The residents spoke up, the admin spoke up. There are people who are ready to share, ready to educate, ready to partner, and bravery and courage is required.
So this is Scott, and I just want to piggyback on the question to the panel a little bit to kind of ask you to expand upon what Lola was just talking about a little bit. So forever I've heard, don't ever talk about race, religion, politics, and money, because people are either scared of saying the wrong thing, they're worried about if they don't agree with anything, how that comes out, and to start somewhere down a path or rabbit hole they don't want to. And so for somebody like me, a white male department chair that's going in, what advice do you have to people of, what authority do I have to be able to talk on this, or how do we start these conversations to kind of talk and expand about some of the things that you were just talking about? So maybe it's not even a mistake that's been made, it's just a non-starter. What advice do you have for people like myself, for people that are out there to basically want to start that, but want to start it in the right way and have open and honest conversations?
Yeah, thanks for your question. I mean, I love that. I think just the way you worded the question, as a department chair, like, and it's the same streams that we're hearing, I feel like I don't have any credibility. How would I do this? As a department chair, you are like the leader in the department. So even just that expression of humility gives other people permission to join you in the conversation. Let's learn this together. And what the department chair has is the power to devote the time to call on the division chiefs, the different specialties, to have someone appointed to, or ask people who wants to step to the plate to help us take a deep dive. And like you said, just be prepared. You probably know who will and who won't anyway. And you don't want to force the person who doesn't want to do it, because it's going to be a failure. So but I think the chairs have such power in just being brave and saying, this is horrible. We must act. This is the time we are going to dedicate it within our formal existing curricula, not after hours, not on your own time. That's additive. You can do both. And those who are doing both are doing better because they're spending more time. But that's the power of a department chair. And you are going to motivate people. You are going to enable them to stand up. And just doing that, you are saying, this is important to our department. And there are going to be people who are going to step up to the plate, and you are giving them permission. But if the department chairs don't step up, those who had an inkling or some small idea or a big idea, they may say, well, it's not important in my department, so I'm not going to do it. Or I'll do this small thing on my own time, but I have to focus on what the chair thinks is important. So if the chairs don't think it's important, it's not going to happen at a high level, not at the level that it needs to happen.
Okay. I was just going to say that people shouldn't be afraid of making mistakes. As we talked about earlier, we make mistakes all the time. And I would really ask that even if you make a mistake, we rather that you try and come back and take feedback, as we may have to learn how to do, and try again. I think as the twin scourges of both systemic racism and its translation into brutality against Black people, as well as the outsized effect that COVID-19 has had on communities of color, as those things intersected, a lot of communities, a lot of societies were releasing statements saying, I stand in solidarity with Black lives, or what have you. And there was a lot of parsing. You can see that on Black Twitter as well as Black Med Twitter, people parsing those responses. How sincere were they? Did they reflect the perspective of any actual Black person? Were they probably written by the one Black person on the board, thereby imposing more work on that individual at a time when they're coping with what is obviously a very difficult period for them professionally, and they need to just kind of keep chugging along. So there's a lot of parsing and investigation and criticism of some of these statements. And then what happened is that I think many groups chose not to release anything because they were so afraid of how people would respond to them and judge them based on the negative responses that some organizations had. And I actually think that's tragic. And I would actually go further to say that I wish that the organizations that quote unquote got it wrong or didn't do a great job the first time, or maybe missed some aspect of the message that other people would have wanted, that they left those first statements up. I would rather see evolution and change and progress and a willingness to own a mistake than to simply erase it and to delete that tweet or delete that message from your board. And I hope people just keep coming back and recognize that, as Carla beautifully said in her Association of Women Surgeons speech in San Francisco last year, sometimes the sculpting will hurt. She gave this amazing talk on how your best mentors are going to sculpt you into a person, but sometimes the chiseling hurts. And that's actually the people who really love you, who will take the time to tell you all the ways in which you could be better. I think all of us can speak to how painful the bigotry of low expectations is. When people don't frankly push you to be a better surgeon, to be a better writer, to be a better academician, because they want you, they don't want to hurt your feelings, they want you just to get by. Well, you know what? Likewise, amongst Black surgeons, we don't want to lower expectations for our colleagues, because there is a certain love and respect we have for other surgeons. We believe that we are capable of this as a profession, that others are capable of this as individuals. And so we don't want to hold you to that low standard. If we come and we criticize, it's out of love and it's out of a belief that you can do better. And so I would encourage people to try again, and versus giving up or being afraid to try and potentially not get it perfect.